Hello, and welcome to the Ohio Department of Aging's brief tutorial for completing the Critical Access Rate Attestation and Tool. My name is Meredith Finley, and these next several slides will walk you through how to complete the form to submit to the Ohio Department of Aging to receive the Critical Access Rate. The agenda for the tutorial includes a review of the provider memo that was published on May 24th about the critical access rate. We'll talk about the steps that you'll need to take to complete the attestation, and we'll also talk about the tool that you'll complete to help answer the questions on the attestation. At this time, I recommend that you have both the attestation and the tool open so that you can follow along the presentation and complete it as we go through it together. On the Ohio Department of Aging's website, you'll see news and events at the top and provider memos on the left panel. And as you scroll down, the critical access rate increase approved for July 1 is the provider memo that houses the rule where the critical access rate can be found, as well as the next steps for completing the critical access rate attestation. So please visit this page and subscribe if you haven't done so already by clicking the subscribe button here. Next, we'll go over the attestation. Now would be a good time to open up the attestation so you can follow along with the presentation. Providers that have multiple locations will need to have a separate attestation for each location. Also, any missing information in the attestation will result in the attestation being returned to the provider. So please make sure that before you send the attestation that every field has been completed. In Section A, you will complete just general information about where you are delivering services. And that last line asking for the Medicaid waiver number, this is a 7-digit number that should be on the contract that you have signed with your Passport Administrative Agency or PAA. So please call your PAA provider relations staff member if you need that Medicaid ID number. It's very important that this reflect the waiver number associated with your contract. We're going to go over Section B next. And Section B is specifically for providers who were initially certified during the current state fiscal year and who billed during the current state fiscal year. Now, the current state fiscal year is anytime between July 1st, 2023 through June 30th, 2024, and is referred to as state fiscal year 2024. So if you were a provider who was certified and who billed any time during this time frame, you would complete Section B. If you are a provider who has billed for many years and who has been certified for many years, then you are going to complete Section C. We'll go over Section C in just a little bit. So Section B, again, is for our providers who were initially certified during this state fiscal year. If you have questions about whether or not you fall into this category, there will be a slide at the end with my contact information, and you can reach out to me and I'll help you answer that question. So to complete Section B, we're going to switch between the attestation as well as the critical access rate tool that will help you calculate whether or not you have the criteria to bill for the critical access rate. So question 1 says that you need to have the average daily census of the facility since you began billing. And to answer that question, we'll on the next screen go through the CAR tool or the critical access rate tool, and it will calculate that number for you. And then question number 2 in Section B is the average daily census of residents who were enrolled in Medicaid since you began billing, and the instructions for that are on the next slide. But first, let's open up the critical access rate tool so that you can follow along and complete that as well. This is the critical access rate tool and is an Excel document. The document has been locked so that you cannot manipulate the formulas. There are 2 tabs in the tool, the daily census tab, which is what you see here, and the Medicaid IDs and My Care tab, which we'll go over in a little bit. Columns B and C are in red, and they will turn white once you add a value into each of the columns. Every column needs to be completed so that it turns from red to white. And that is because the way the formulas are set up is that it has to include some value. So if you are a provider who didn't start billing until September, then you would still put zeros in all of those cells to reflect the changes from red to white so that the formulas work correctly. So you can see an example here. And as you complete the tool, if you scroll all the way to the bottom, the value of the last line here will change. So if you have 200 on June 27th for your daily census and you have 198 for your Medicaid census, you'll see that the totals for both columns B and C will change. It's going to take some time to complete this, but it is important that each line does have a value in it. The answer for question number 1 on the attestation is 300 in this example. So this is the number that you will put into the attestation for question 1. For question 2, again, this is in section B of the attestation. When you have completed your entire column C, the value that you see here, 256, is what you will put in question 2. As you move down in section B, you'll see at the top the directions for utilizing the tool to complete the answer to question 2, which we just reviewed on the previous slide. Question number 3 is the average daily percentage of residents who were enrolled in Medicaid since you began billing. There's a screenshot of the Excel sheet that has the answer to question number 3, which is in green. So question number 3 in this example is 85%. So you would put the 85% answer into question number 3, and that will then help you answer question number 4. So if your answer to question 3 is 50% or higher, you would select yes, and then you would continue to question 5. If your answer to question 3 is not 50% or higher, then you do not qualify for the critical access rate at this time, and you do not need to do anything else. You do not need to send the form or the tool to ODA. There are other ways to qualify in the future, which will be addressed at a later date, but at this time, if your answer to question number 3 is not 50% or higher, then you do not qualify. Question number 5, do you project having an average of at least 50% of your residents enrolled in Medicaid each month between July 1st of 2024, which is a future date, through June 30th, 2025. So this is now a projection of whether or not you will continue to have 50% or more of your residents enrolled in Medicaid. Then you'll select the answer that is most appropriate for you. If you are a provider who selects yes, you'll continue to section D on the attestation. If you do not anticipate that you will meet this criteria, then you would not qualify for the critical access rate at this time. And similarly to the answer to question 4, if the answer is no, there will be further information coming out about how you could qualify in the future. So this is a projection, and what that means is that while you are attesting that you will likely meet the criteria for the critical access rate, the information that you'll be sending in right now to verify that is just the attestation document at this time. So you'll see in bold the next steps that for providers who have completed section B and answered yes to question 5, you'll be required to send the critical access rate tool to the Department of Aging in 2025. So again, the only thing that you're going to send at this time is the attestation. The tool is simply for you to use to calculate your responses. So the first tab, the daily census tab, is the part of the tool that you use to answer questions in section B. And the other tab, the Medicaid IDs and MyCare, is for the providers who provide responses in section C and who are needing to send evidence of verification that all of their folks were Medicaid eligible at the time that they were billing. So again, if you have questions about what you're supposed to send, what you're supposed to complete, please feel free to email me and I will assist. If you completed section B, then you do not complete section C on the attestation form. Section C is for providers who were initially certified any time before June 30th, 2023, but it are also for providers who have billed each month from July 1st, 2023 to present. Again, if you're not sure which section you are to complete, feel free to email me. Similar to section B, you will use the CAR to complete section C, and you will open up the CAR tool to complete columns B and column C in the Daily Census tab. You will make sure that each line turns from red to white to indicate that a value has been added. And when you scroll all the way to the bottom of the Excel document, the total number in column B is what you will put to question number 1 on this screen. Down the attestation, still in section C, you'll see the rest of the questions on the attestation form. And again, utilizing the CAR tool, you will put your answer from column C that you have on the tool into question number 2. And there are instructions on the document here. And then number 3 is your answer that is reflected in column E, which is the green box on the CAR tool. And if your answer to question number 3 is 50% or higher, then you will select yes, and you'll continue to move down to the next steps. But if your answer to question 3 is not 50% or higher, then you would not qualify for the critical access rate at this time, and you do not need to send any information. The next steps for completing section C include completing the other tab that's in the Excel document. So on the next slide, we'll open up that document and walk through each of the steps that you need to take to complete that section and to save and send it as along with your attestation. Earlier in the presentation, I said that there were 2 tabs at the bottom of the CAR tool. The first one was one that we went over already, the Daily Census tab, and then the other tab is called Medicaid IDs and MyCare. This tab needs to be completed only for providers who are completing section C on the attestation. If you are a provider who completed section B, you do not need to fill out this tab, and you only need to utilize the Daily Census tab to determine your calculations to answer the questions. So if you are a Section C provider, this is the tab that you need to complete and send to the Department of Aging to support that you qualify for the critical access rate. There are instructions on the attestation form, and we have included them on this tab as well. And so we are asking that you select any 3-month period or 1 quarter of time that you billed during the current state fiscal year, which is any time between July 1, 2023 to present, and you put the resident name of each Medicaid enrolled resident here in column C, and then in column D, you will add their resident Medicaid ID. And if they are on a MyCare plan, you will include the name of the plan that is serving them. So we ask that you add which 3-month period you are using. So if you used March, April, May, just include that answer in green here. And then if you have residents who have been there during that entire period, you don't need to write their name 3 times. We're just asking that you put unduplicated information here. Do not put duplicate information. And then put the rest of the information as applicable here. Save your information, and then you are going to attach it to the email when you send your attestation, and we'll go over that information next. Section D is the last section on the attestation and must be completed by providers who filled out both Section B or Section C. And you are asked to put your name and your title, a signature and date on the form, and that the form, the attestation form, and the critical access rate tool for Section C providers needs to be submitted and handled in accordance with HIPAA regulations to ensure the protection of sensitive health data. Because you are submitting to the Department of Aging Medicaid information, Medicaid ID specifically, it has to be sent securely. So please ensure that all information that is sent to me to attest to the critical access rate is sent securely. And I have my name and my email address listed there. We have to receive completed attestation forms no later than Monday, June 24th, in order for you to start billing at the new rate by July 1. As I've said throughout the presentation, if you have questions about completing the attestation form or completing the critical access rate tool, please don't hesitate to email me. You can also call me. This is my work cell, and I will return your call as soon as I can. But don't hesitate to reach out if you have any questions. Thank you, and this concludes the pre-recorded tutorial for completing the critical access rate attestation and tool.